Hello, I'm Dr. Shana Jamil and I'm one of the GPs at Chineham who fits coils. This is my daughter Sadia and she's a senior medical student.
Today we're going to describe to you which coils are available at Chineham and hopefully help you decide which one you might prefer. There are two types of coil, the copper coil, also known as the IUD, and the hormone coil, also called the RUS. For the sake of this video, we will refer to these two coils as the copper coil and the hormone coil.
There are many different brands of coil available, particularly the hormone coils. You may have heard of the Mirena, the Coil and the Levocert. At Chineham, we use the Mirena.
This is a copper coil. It's a small 3cm T-shaped device that sits in the womb, and it's covered with copper on the arms and the central portion. All coils have two threads which extend from the bottom of the coil, and these are there so the doctor and you know that the coil is in the correct place. Once it's in the correct position, these will be cut a little bit. Please note that these threads are not visible externally like a tampon thread might be. The copper coils we use at Chineham are the T-Safe Copper 380A coils, and these last for 10 years, although note that some coils only last 5.
Well, the way it works is that the copper from the coil stops the sperm from surviving in the womb. It also changes the lining of the womb so that a fertilised egg can't implant to start a pregnancy. It's more than 99% effective, which basically means that if you took 100 women using a coil over a year, one of them could get pregnant, as opposed to 80 to 90 women who could get pregnant not using any contraception at all. Well, it's a very effective method of contraception. It works immediately as soon as it's fitted, and when it's removed, your fertility returns to normal very quickly. You can use it when you're breastfeeding, and because it doesn't contain any hormones, it doesn't interact with any other medication. Yes, with the copper coil, your periods may become longer, heavier, or more painful. There is a small risk of infection after the coil is fitted, and the other thing you should be aware of is that unlike condoms, the copper coil cannot protect you against sexually transmitted infection. The copper coil can only protect you against pregnancy in the womb, so that means it can't protect you against a pregnancy in the tubes. So if you do get pregnant with a coil in place, you should contact your doctor quickly, because it could be an ectopic pregnancy, that is, a pregnancy in the tubes. There are other risks associated with having a coil fitted that apply to both the copper coil and the hormone coil, and we will go through these at the end of this video. Generally speaking, anyone could have the copper coil fitted, even someone who's never been pregnant before or never given birth. You can discuss with your doctor specific reasons why you shouldn't have a coil fitted. This might be because you have a structural problem with your uterus or your cervix. Women who already have heavy, painful periods may prefer not to have the copper coil, as it could make their periods worse.
This is the hormone coil, or RUS, which is very similar in size and shape to the copper coil. However, this one contains the hormone progesterone, which is released gradually over the course of 5 years.
It works in 3 different ways. Firstly, it makes the lining of the womb thin so that a fertilised egg can't implant into the lining of the womb and start a pregnancy. Secondly, it makes the cervical mucus thick so that sperm can't pass through the cervical mucus into the womb. And finally, in some women, it stops them ovulating. The hormone coil is also more than 99% effective. The obvious benefit is that it's a very effective method of contraception. Although depending on where you have it fitted in your cycle, it can take up to a week to start working. When you have it removed, your fertility returns to normal very quickly. The hormone coil can help women who have painful, heavy periods. It can make your periods lighter and less painful. The hormone coil can be used in women who are breastfeeding and women who are on other medication, as it does not have any significant interactions with any other medications. It is also used by some women on HRT to protect the lining of their womb. Since this coil contains hormones, it is possible you could suffer with some hormonal side effects, even though the amount of hormone that reaches your bloodstream from the coil is very small. The hormone contained in the coil is progesterone, and it can therefore cause acne, headaches, weight gain and breast tenderness in some women. Most of these symptoms will settle down after the first 3 months. Similarly, some women will suffer with irregular vaginal bleeding when they have a hormone coil fitted. This can take the form of irregular spotting, which could occur for the first 3 months. However, the vast majority of women find that by the time they've had the hormone coil for a year, they are experiencing less than 1 day of bleeding per month. The first thing to say is that fitting a coil can be uncomfortable, and most women will experience some period-like pain during the fitting. All coils have to be fitted into the womb. In some women, this may not be possible because their cervix is too tight. This is more common in women who've never given birth. In 1 in 20 women, there is a risk that their body will reject the coil and expel it or push it out. If this were to happen, they might experience pain or bleeding. So in 2 in 1,000 women, there is a risk that the coil could be pushed through the muscle and end up in the wrong place. If this were to happen, you'd have to be referred to the gynecologist for them to remove it safely under anaesthetic. It's a little bit more common for this to happen if you've just had a baby recently or if you're breastfeeding. There's always a small risk of infection with some medical procedures, particularly coil fittings. At Chineham, we can also check you for pre-existing sexually transmitted infection like chlamydia before we fit your coil. So to summarise, both coils are more than 99% effective. The copper coil lasts 10 years, but could make your periods heavier and possibly more painful. The hormone coil lasts 5 years, but could help your periods become lighter and possibly less painful. I hope we've given you enough information to help you choose between the two.
If you would like to discuss having a coil fitted, please call the surgery to book a telephone consultation with either Dr. Jamil, Dr. Harper, Dr. Yarnton or Dr. Marsden, or alternatively submit an e-consult on the Chineham Surgery website and someone will call you back. For more information, please visit www.fpa.org.uk and search for leaflet and booklet downloads. Thank you.
Thank you very much.